I'm Alex Toledo. I'm a professor of surgery here at the University of North Carolina in the Division of Abdominal Transplant Surgery. I'm an abdominal transplant surgeon, and I'm also the surgical director of the kidney transplant program, and I serve as the service line leader for our division. Like a lot of physicians, I became interested in medicine out of a curiosity, a scientific curiosity, and also a desire to help people. I always wanted to find a job that I had felt like I was doing truly meaningful work, and I was very fortunate that my father was a surgeon and I didn't have to look far for a role model. The other person that had a big influence on that was my mother, who was an ICU nurse in my youth and later on very active in the community, and from her I really understood the value of giving back to other people. Abdominal transplant surgeon is someone who's transplanting predominantly the organs in the abdomen, the kidney, the liver, pancreas. The primary duties that I have here, I have a wide breadth of surgeries that I do, but the primary focus of my practice is the surgical aspects of kidney failure, and that includes kidney transplantation, living donor procedures such as living donor nephrectomy, and also vascular access and dialysis access care for patients who are approaching dialysis. I think the most important thing for patients to know that come for their transplant care here at UNC is that we have a big team and we're ready to walk them through the entire process. For some patients, it's a shorter transition from end-stage kidney or end-stage liver disease to transplant. For other patients, it's a long process, but either way, I think we have the expertise and the persistence and the infrastructure to supply fantastic care. I want a patient to know that I wish they could experience, like I get to experience, is the moment that's the culmination really of all of our work and all of their journey in a lot of ways, is that moment in the operating room when perhaps after years of working to get them there, we've identified a good organ for them, we've prepared it, we've started the surgery, we've found vessels that we think are compatible to find the organ, and we've got it a new home, we sew the vessels in, and then at that moment, whether it's the kidney or the liver, we're sort of ready to go, and we open up the clamps and the blood rushes into the organ, and it goes from being cold and pale and really lifeless to immediately it perks up, and it's a bright pink hue, and it's immediately see that you've taken someone and changed the trajectory of their life with seeing that just life rush into the organ. It's a pretty exciting moment. What I love about UNC is everyone is very focused on the mission of serving the state of North Carolina. The mission at UNC is to sort of make sure everybody has a chance and everyone has a voice, and that everyone has the opportunity to get world-class healthcare at our institution, regardless of where they're coming from or what their resources are. What gets me up in the morning? I would say the fear of missing my kid's school bus gets me up in the morning. But once I cross that hurdle, then it's all downhill. Basically, I always look forward to seeing new patients, working together as a team with all of our nurses, our pharmacists, our nephrologists, our coordinators, our operating room staff, everyone working together to get to the point where we're able to take someone and get them to the operating room and get them off dialysis or get them a new lease on life, really.